Well, it's been a campaign unlike any other. The final countdown to the election is coming just as the country battles a new and alarming wave in coronavirus cases. All 13 of those battleground states we've been talking about are seeing an increase in confirmed cases today. ABC News' chief national correspondent, Matt Gutman, joins me now with more. Matt, I think you've got to be one of the leading reporters across the country on this pandemic. Hats off to you. You're back home in Los Angeles right now. Take us to the front lines. You've seen in hospitals in various places, I think recently, Utah, Idaho, Montana, how they're dealing with this. What are you seeing on those front lines?
I'm really going to tell you a tale of three cities right now, Terry. First, with a lot of talk about Texas in this show, so we'll start there. El Paso, right? El Paso is basically seeing the worst of all worlds. That is the spot that not only has one of the highest COVID rates in the country, but also the highest number of hospitalizations. The city now pretty much on lockdown. There's a significant amount of political fight about how the lockdown should function. The county judge calling for it, the governor now trying to rescind the order. I won't get into that, but I'll give you a picture of what it looks like. Right now, a group named the BCSF, which is a major disaster relief organization, has built up those tents around the hospitals there. They alone have 800 staff members tending to the hospitals, building them up. They are flying patients out of El Paso. And right now, we're just in the stage of hospitalizations. In a couple of weeks, we're going to see deaths, and a lot of them, unfortunately, in El Paso. I'll take you farther north. Salt Lake City, we were there 2 days ago, and there they are approaching capacity at the hospitals, right? COVID rate is soaring. They've doubled the numbers over the past month or so, and they're trying to deal with the influx there. They are on the precipice of something very, very bad because the main hospitals there, the Intermountain Healthcare Center, that basically takes care of people from Wyoming, Nevada, Utah, and Idaho as well. So they're about to get totally slammed. And then the place we were yesterday, Rexburg, Idaho, the #1 COVID hotspot in the entire country. It is a very small city with a very large college population, right? So it has the highest rate. Nobody, well, I wouldn't say nobody, but I'd say 50% of the people I saw wore a mask. I talked to college students. They said not once have they ever been asked to put a mask on going into any restaurant or supermarket. Most of their friends don't wear it. One young woman said, hey, I just had it. And her friend says, oh, that's interesting. They still weren't wearing masks. So that hospital is actually fine because the vast majority of people who have gotten sick there are young people, and if they have to be hospitalized, it's for a very short period of time. And so I actually went into the ER yesterday afternoon, and it was empty, not a single person there. So it really gives you a sense of the variety of what we're seeing across the country, and really that sense that some of these hospitals are empty because young people are getting sick serves to continue and prolong that vicious circle of people saying, well, this really can't be real. People aren't really getting sick, so why should I wear a mask? Why should I practice hygiene? Why should we socially distance? It's a very dangerous thing, Terry.
And Matt, that takes us to politics. We're a political show at this point, and I want to ask you, because you've got an excellent political mind, about that divide that you just described. President Trump is basically saying, let's get past it. We're almost past it anyway. We've got to get on with our lives. We can't let this thing dominate our imagination and our lives. Democrats are saying we've got to save lives and buckle down, if not lock down. You're seeing that play out in real life. Have you got a sense that one side is more persuasive with Americans?
It's a really interesting question, right? I feel like the entire country right now is in this very large Scopes monkey trial, right? It's science versus all the other stuff. The fact is, these work, and I'll give you a personal anecdote, right? You and I both travel a lot. I have a cold every single month from February through the summer, right? For like 8-10 months, I have a cold. This year, I have not gotten sick once because I wear a mask pretty much everywhere I go. I practice hand hygiene. I socially distance. Coronavirus is a cold. It is a type of a virus that is very similar to the common cold, right? It is deadly, but people refuse to believe that these work, and they don't want their rights infringed upon. So in the redder states that we have gone to recently, parts of Texas, Idaho, Utah, Montana, South, North Dakota, that's where COVID is truly taking off right now because people are making a political stand out of wearing these. It should not be. It is sad to see. And the results are that we are likely seeing many more, tens of thousands of deaths, probably, maybe 100,000 deaths than we should have seen at this point, Terry.
All right, Matt Gutman, back home in Los Angeles. Good to see you. Thanks for that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.